Imagine this. You're in a building that claims to be a hospital, but it smells like a bin fire had a fight with a sewer. There are wounded soldiers stacked so tightly that personal space is a myth. The water is questionable. The food is technically food, I suppose. And the death rate is so high it's basically a subscription service. Now imagine one person walks in, not a general, not a surgeon, not a politician, but a woman from a rich Victorian family with no official power, armed with paperwork, stubbornness, and the audacity to clean things. And in the process, she drags modern healthcare kicking and screaming into existence. This is the story of Florence Nightingale. And trust me, the famous lady with the lamp image is just the start. The full story is way more interesting. Because Florence didn't just nurse people, she fought bureaucracy, weaponised statistics, and reprogrammed the British medical system like it was a faulty toaster. Welcome to the Curiosity Diary. Now let's get into it. So, Florence Nightingale is born in 1820 into a wealthy British family. And when I say wealthy, I mean the kind of wealthy where your biggest daily struggle is choosing between being bored in one mansion or being bored in the other mansion. Now, in Victorian high society, a young woman of her class had a very clear job description. Marry well, host dinners, never do anything that involves bodily fluids, strong opinions, or employment. And Florence is like, no. Because as a teenager, by her own account, she experiences what she calls a calling. Not, I'd like a new hobby. Not, I think I'll start Pilates. A calling, the kind that takes over your whole life. And here's the thing. In the 1840s, if a respectable woman said, I want to be a nurse, people heard, I would like to ruin the family name and possibly live in a gutter. Because nursing wasn't this noble professional thing yet. It was often seen as messy, low-status work, sometimes done by women who were desperately poor, untrained, or seen as, let's just say, not the kind of person your mum wanted you hanging out with. Florence's family was horrified. Her mother and sister want her to be the charming, socially successful, and safely decorative. Florence wants to go into hospitals and help the sick, which in their world is basically announcing you're joining a pirate crew. So she starts doing what she'll do her entire life, quietly building competence while everyone underestimates her. She studies, she reads obsessively, she learns about hospitals, public health, sanitation, basically everything Victorian society told her not to poke her nose into. And she keeps pushing for training. Eventually, she manages to get real experience, most famously at a training institution in Kaiserswerth in Germany, where deaconesses were providing organised nursing care. And Florence is alive there. She isn't playing Rich Daughter Simulator. She's learning how a hospital actually functions. Routines, hygiene, supplies, discipline, management. Which is key, because Florence Nightingale's superpower isn't just compassion, it's systems. She's not only thinking, how do I help this patient? She's thinking, why are patients even ending up like this? And how do I stop the machine from producing suffering? And then, the machine hands her the biggest, most brutal test imaginable: war. In 1854, Britain is involved in the Crimean War, and the fighting is nasty. Yes, but what truly shocks the public back home isn't just the battlefield, it's the hospitals. Reports start coming back, especially through war correspondents describing conditions that sound less like medical care and more like a medieval punishment. Wounded men are shipped to military hospitals. And they aren't dying mainly from their injuries. They're dying from infection, disease, filth, and neglect. And at this point, Florence has a reputation. She's organized, she's serious, she's competent, and she's not intimidated by a room full of men who've never been told no in their entire careers. A key political figure, Sidney Herbert, who's linked to War Office Administration, knows her, trusts her, and basically calls her up like, "Florence, it's chaos, please fix it." And Florence doesn't hesitate. She assembles a team of nurses, dozens of women, and heads to the main British military hospital at Scutari near Constantinople, modern-day Istanbul. And this is where the legend begins. But it starts with a scene that is honestly hard to overstate. Now, Florence arrives at the Barrack Hospital in Scutari in late 1854, and what she finds is a horror show. Not a bit disorganized, not needs improvement. I mean overcrowding, sewage problems, poor ventilation, dirty bedding, rats, insects, supplies missing. The kitchen is a mess, laundry is a mess. Basic sanitation, a fairy tale. Wounded men are lying in their own filth. Some haven't been properly washed. Some don't have clean bandages. And diseases like cholera, dysentery, typhus, things that spread fast in overcrowded, unsanitary places, are ripping through the hospital. Now here's the twist people don't always include in the lady with the lamp myth. Florence doesn't arrive and instantly get applauded like a hero in a Marvel movie. She arrives and a lot of the military doctors are like, "Who is this woman and why is she in my hospital?" Because Victorian military hierarchy is, how do I put it gently, is a system where a man with a title can be wrong loudly and still outrank reality. So, Florence has to fight on two fronts, the medical disaster and the ego standing in the way of fixing it. At first, she's blocked from doing much. The nurses are sometimes treated like nuisances. There are disputes over authority, and Florence quickly realizes something crucial. You can't nurse your way out of a broken system. Not if clean sheets don't exist, not if food doesn't arrive, not if the building itself is basically a disease factory. So she does what she's best at. She starts building an operation. She organizes supplies. She sets up laundries to get clean linens. She improves diet because shockingly people heal better when they're not living on sad biscuits and regret. She creates routines, cleanliness, order, and she is relentless. If you imagine Florence as this gentle floating angel, I regret to inform you, she's more like an elite project manager with a halo. The nurses under her aren't just holding hands and whispering encouragement. They're scrubbing, organizing, triaging, caring, writing, enforcing discipline. And Florence is everywhere. And yes, this is where the lamp comes in. At night, she walks the wards, checking on men, speaking to them, listening, making sure they aren't forgotten. That image, Florence gliding through lamplit corridors, becomes iconic. But the lamp is the symbol. The real revolution is what she's doing during the day, turning chaos into care. Now here's where we need to be honest, because history is messy. Even after Florence arrives, death rates remain horrifyingly high for a time, because the hospital's underlying sanitation problems are so severe that nursing alone can't immediately stop the tidal wave of disease. Eventually, a sanitary commission is sent in, and major infrastructure issues like drainage and ventilation start being properly addressed. And when those changes combine with better hygiene and organization, the death rates drop dramatically. Florence understands something most people around her do not. If you want to save lives at scale, you don't just treat wounds, you redesign the environment causing the wounds to become death sentences. And she keeps meticulous records of everything. Not just because she's a nerd, though respectfully, yes, she is, but because she knows what's coming next. Because the war will end, and then the real fight begins, convincing the British establishment that this wasn't bad luck, it was preventable, and she's going to prove it with numbers. Florence returns to Britain a national hero, but she doesn't really enjoy the celebrity, partly because she's exhausted and unwell. She suffers long-term health problems after the war, but also because she knows the public loves a tidy story. They want brave nurse goes to war, holds lamb, saves men, the end. Florence is like, actually no, the end is the government fixing its entire medical system, thank you very much. So she goes to work, largely behind the scenes. She compiles data, causes of death, conditions, timelines, everything. And she does something that feels totally normal to us now, but at the time was basically sorcery. She uses statistics to argue for reform. She creates these striking visual diagrams, often described as a kind of coxcomb or polar area chart, that makes one point painfully clear. In the Crimean War, soldiers were dying in huge numbers, not mainly from battlefield injuries, but from preventable disease. In other words, the enemy wasn't just the Russians, it was filth. This is one of the most important pivots in modern medicine and public health. Florence helps shift the mindset from people die, war is hell, what can you do, to people die for reasons and we can reduce those reasons. She pushes for major reforms in military hospitals, sanitation standards, and medical administration. And she isn't doing it by yelling, she's doing it the most terrifying way possible, by being correct, on paper, with evidence. You can argue with a person, you cannot easily argue with a spreadsheet. She influences commissions, advises officials, and pushes for improvements in barracks, hospitals, and training. And here's the wild part. Florence Nightingale is not just shaping nursing, she's shaping the idea that healthcare should be accountable. That if people are dying under your care, you don't get to shrug. You investigate, you measure, you fix, which should be obvious, but at the time it was revolutionary. And then she does something that cements her legacy for good. She professionalizes nursing. In 1860, Florence helps establish a training school for nurses at St. Thomas's Hospital in London, funded through public donations connected to her fame. This matters because it's one thing to be a heroic individual, it's another thing to build an institution that outlives you. Her approach to nursing is disciplined and practical. Cleanliness, ventilation, observation, consistent care, training, standards. She also writes a lot. Most famously, she produces work that becomes hugely influential, including Notes on Nursing, which is essentially a guide to what nursing should be. And again, she's not presenting nursing as vague kindness. She's presenting it as a skilled profession with principles, methods, and responsibility. It's care, but with competence, compassion, but with structure. And this transforms public perception. Nursing becomes something people can be trained in, trusted in, respected for. Florence helps lay the groundwork for modern hospital practices and for the idea that the environment, light, air, cleanliness, nutrition, directly affects patient outcomes. And sure, later science will refine a lot of the why, especially with germ theory and antibiotics. But Florence is early to the most important idea. If you reduce the conditions that let disease spread, fewer people die, which is such an obvious sentence now, that it's easy to forget someone had to fight an entire empire to make it policy. So when you hear Florence Nightingale, don't just picture the lamp. Picture a woman who defied her class expectations, walked into a medical catastrophe, built order out of chaos, demanded evidence, and forced the system to change. She didn't reform medicine by being nice, she reformed it by being relentless. And maybe that's the most modern thing about her. Because even now, the people who usually change the world aren't the loudest in the room. They're the ones who show up, do the work, collect the receipts, and refuse to let anyone look away. And that is Florence Nightingale. If you enjoyed this and want more stories of people who basically grabbed history by the collar, subscribe to The Curiosity Diary, and I'll see you in the next one.